Ever had a nosebleed and wondered, what on earth just happened? Today we're breaking down the causes and how to stop one fast. No fluff, just facts. Nosebleeds are more common than you might think. Whether it's from a dry winter day or a surprising bump on the face, most of us have dealt with one at some point. It can be really scary in the moment, especially if you're not sure what's causing it or how to handle it right away. In this video, we're diving into the real reasons behind nosebleeds and sharing quick, research-based methods to put an end to them fast. You'll learn what might be triggering your nosebleeds and exactly what you can do when they strike. First off, let's talk about why nosebleeds happen. Your nose is lined with a network of tiny blood vessels that are very close to the surface. These vessels can burst for a number of reasons, and here are some common culprits. Dry air. During winter or in arid climates, the dry air can cause the inside of your nose to become parched. This dryness can make the blood vessels more fragile and prone to cracking. A study published in the Journal of Investigative Dermatology noted that low humidity levels can lead to skin and mucous membrane dryness, which can extend to the nasal passages. Nose picking. It might sound obvious, but even a minor irritation from nose picking can damage the delicate vessels. Kids and even some adults may inadvertently trigger a nosebleed by doing so. Allergies and infections. Conditions like sinus infections or allergic rhinitis, commonly known as hay fever, can irritate the nasal lining. The inflammation and frequent rubbing or blowing of your nose in these conditions can cause bleeding. Injury. A hit to the nose, whether from a fall or during contact sports, can break blood vessels. Even if the injury doesn't seem severe, it can lead to unexpected bleeding. Underlying health conditions or medications. Sometimes, frequent nosebleeds might be a sign of an underlying condition, such as a blood clotting disorder or a side effect of medications like blood thinners. Research from the American Journal of Hematology highlights that certain clotting disorders can manifest through recurrent nosebleeds. Now that we know some of the reasons behind nosebleeds, let's move on to what you can do when one occurs. Here are some steps that are backed by medical research and expert recommendations. Stay calm and sit up. It might be tempting to lie down when you feel dizzy, but staying upright helps reduce blood pressure in the nose. Lean forward slightly to prevent blood from running down the back of your throat, which can lead to nausea or even vomiting. Pinch your nose. Using your thumb and index finger, gently pinch the soft part of your nose just below the bony bridge. Do this continuously for at least 10 minutes. A study from the British Journal of General Practice confirms that sustained pressure is effective in stopping most anterior nosebleeds, the ones that start in the front of your nose. Breathe through your mouth. While pinching your nose, breathe slowly through your mouth. This simple technique not only helps you stay calm, but also aids in keeping the pressure steady. Apply a cold compress. If you have a cold pack or even a bag of frozen vegetables, wrap it in a towel and apply it to the bridge of your nose. The cold can help constrict blood vessels, reducing the bleeding. This method is also supported by guidelines from the American Academy of Otolaryngology. Avoid blowing your nose. Once the bleeding stops, avoid any activities that might disturb the clot, such as blowing your nose or picking at it. This allows the healing process to begin undisturbed. While knowing how to stop a nosebleed quickly is essential, preventing them in the first place is even better. Here are some tips to help keep your nose in tip-top shape. Maintain humidity. If you live in a dry area or during the winter months, consider using a humidifier. Adding moisture to the air can keep the nasal passages from drying out. The Environmental Protection Agency has noted that proper humidity levels can prevent a host of health issues, including respiratory discomfort. Keep your nasal passages moist. A saline nasal spray or a dab of a water-based nasal gel can be very effective. These products help maintain moisture in your nasal tissues, reducing the risk of crack-ups in the delicate blood vessels. Be gentle with your nose. It might seem simple, but try to avoid frequent nose picking or forceful blowing, especially during allergy season when your nasal tissues are already sensitive. Monitor medications. If you're taking blood-thinning medications or other drugs that might contribute to bleeding, it's a good idea to discuss this with your doctor. They might adjust your dosage or suggest preventive measures to reduce the risk. Healthy lifestyle. Staying hydrated and maintaining a balanced diet that supports vascular health can also help. For example, foods rich in vitamin C and bioflavonoids can strengthen blood vessels. Studies have shown that a nutrient-rich diet supports overall blood vessel integrity, reducing the likelihood of spontaneous bleeding. Even though most nosebleeds can be managed at home, there are times when you need to see a doctor. Here's what to look out for. Frequent nosebleeds. If you find that nosebleeds are happening more regularly, it might be a sign of an underlying health issue. Research from the National Institutes of Health suggests that recurrent nosebleeds can sometimes point to blood disorders or high blood pressure. Heavy bleeding. If the bleeding is unusually heavy or lasts longer than 20 minutes, it's important to seek medical attention immediately. While rare, heavy bleeding can be a sign of more serious problems. Other symptoms. If you experience symptoms like dizziness, shortness of breath, or if the nosebleed follows a significant injury, don't hesitate to get professional help. Blood clotting disorders. If you have a known bleeding disorder or are on medications that affect blood clotting, any nosebleed should be monitored closely. Consulting with a healthcare provider in these cases is crucial to ensure that there isn't a bigger issue at play. Let's bring in a real-life example to tie everything together. A few years ago, a 35-year-old man, let's call him Mark, experienced sudden, severe nosebleeds during the winter. He initially tried the usual methods, pinching his nose and applying a cold compress, but the bleeding kept coming back. Concerned, Mark visited his doctor, who discovered that his nosebleeds were not just due to the dry air, but also a side effect of a new medication he was taking for high blood pressure. After a minor adjustment in his treatment plan, and with the addition of a humidifier at home, Mark's episodes became much less frequent. This case is similar to findings in a study published in the American Journal of Medicine, where adjustments in medication and home care were shown to significantly reduce the occurrence of nosebleeds in patients with similar profiles. To wrap things up, here's the quick rundown. Nosebleeds are usually caused by dry air, injuries, or even allergies. When one happens, stay calm, sit up, pinch your nose for 10 minutes, and apply a cold compress. Long-term, keep your nasal passages moisturized, maintain proper humidity at home, and avoid unnecessary trauma to your nose. And if your nosebleeds are frequent or unusually heavy, it's important to consult a healthcare professional. Remember, a nosebleed might be alarming, but with the right steps, you can quickly regain control and prevent future episodes. If you found this information helpful, hit that subscribe button and click the bell so you won't miss any of our health tips. Stay safe and take care of yourself.